Good evening. I'm Jeff Flax, the President and Chief Executive Officer of Hartford HealthCare. 2 days ago, when we had a press conference here on the campus of Hartford Hospital, I spoke about the need for communication, our commitment to transparency, and our focus on the accessibility of our team and of the leaders and our staff within our organization. Tonight we come forward with unfortunate news. We come forward announcing that we do have our first patient here at Hartford Hospital with CV-19. Our focus is on caring for this person, treating her and her family. This is a person who is in her 80s, who lives in Rocky Hill, and we are presently working just over the last several hours closely to have our primary focus be really exclusively to care for her under these circumstances and tend to communicate with her family. I do want to recognize our staff, and I want to recognize the tremendous efforts, the commitment under these really extraordinary, in many ways unprecedented circumstances. It's so inspiring to see the way our staff have come forward and are just doing the right thing in following our standard practices and our protocols and caring for all people under all circumstances. And it's never really been more clear than in moments like this. So let me bring to the podium Keith Grant, who is a leader in our infection diseases team, who can speak more clearly and more specifically to the processes we follow here at Hartford HealthCare and in specific circumstances like we're dealing with tonight.
Thanks. Hi guys. So as we discussed before multiple times, we've outlined that this is a process. This is a step-by-step process, and our next step is to ensure that the appropriate processes are put into place in order to do a full investigation, and a lot of focus on multiple focus areas on ensuring that this patient gets a significant amount of whatever care that needs to be for a speedy recovery, and to ensure that a full investigation is done. I want to ensure that we point out the fact that part of this process was to ensure that whatever patient, any patient that's flagged, goes through the appropriate screening process, and I can say that was successful. Going forward, we have a long road just to identify if there is whatever else that we can do to move this forward.
Can you introduce yourself?
Yeah.
Thank you. My name is Ajay Kumar. I'm Chief Clinical Officer from Hartford HealthCare, and I just want to thank everybody to be here at this time. I want to thank Mayor and Mayor of Bronin and Mayor of Hartford to be here. This is an unprecedented time we're living in right now, where we have an event which we have never seen before for a long time. So this is a time for all of us to really remind ourselves that what we are seeing right now in the community we're going to see more of that. This is spreading in the community at this time, and again, this is the time to again remind a few things. Importance of hand hygiene, importance of making sure you take care of yourself in whatever is possible at the moment. Social distancing. Don't touch your face and your nose and other parts of the body, which could lead to some sort of infection. This incident was supposed to come. We were expecting cases to happen in our community, and this is what we're seeing right now. Now, I want to make sure that we talk about that we were waiting. The Hartford HealthCare had been preparing for several weeks on this particular time, and our preparation had been very good, and we were prepared to make sure that when something like that happened, we focused exclusively on the patient and the family member and our colleagues across the Hartford HealthCare who have been doing a tremendous job at this time. And I hope with your presence, and I want to thank all the press who's here right now, you take the message back to the community about the importance of this is not a hype. This is a situation we're dealing with, which is going to, unfortunately, we're going to see more cases in the community, and we have to continue to be ready for that. With that, I'd like to introduce Mayor Bronin.
Thank you, Dr. Kumar, and thanks to the entire Hartford HealthCare and Hartford Hospital team. As Mayor of Hartford, I first just want to say how fortunate we are to have outstanding healthcare institutions in our community, including right here at Hartford Hospital. We have been coordinating closely with them for weeks now. They have been preparing constantly and relentlessly. And just speaking as a member of the community, I feel more comfortable knowing that we've got an outstanding team at this hospital and our hospitals throughout this city. I also just want to say that my thoughts are with this particular patient and her family, and we wish for her a full and speedy recovery. As Dr. Kumar said, we have been expecting that we would see our first case soon. And I think that we can probably say that although this is the first time that we have had a positive test for somebody in our region with the coronavirus, there are probably a number of other people in our region who would test positive right now. We have to acknowledge the reality that not enough tests have been done. And I say that because there's a reason that we've taken the aggressive measures that we've taken as a state, as a region, as a city. As you know, the Hartford Public Schools are closed on Monday for an indefinite period, and we've taken a number of other measures, as have many other communities. Because the earlier we act, the more effective that action is. Lastly, I just want to emphasize again what Dr. Kumar said, which is we as public officials will do everything that we can to slow down the speed of transmission, to flatten the curve, and try to avoid a spike in transmissions and infections that would make the jobs of our outstanding healthcare professionals that much more difficult. But I really want everybody to recognize that there are things that you can personally do every day to take care of your own health and to help slow down that spread too. If you look around here, there's a reason that we're all standing a little bit apart from one another. There's a reason we're not shaking hands. And I think it can't be said enough that the most effective precautions are the most basic ones. To wash your hands a lot, to wash them well, to not touch your face, to avoid big crowds, and needless to say, if you have any symptoms at all, first and foremost, stay home and consult with your healthcare provider. And with that, let me just say lastly, although we're a state with 169 municipalities, we're going to discover through this that we're more tightly tied together than we ever imagined, and we're all going to have to work very, very closely together. And so now I'd like to ask our neighbor, the Mayor of Rocky Hill, Lisa Morano.
Good evening, everyone. I'd like to reiterate what Mayor Bronin said to us, and of course thank all of our medical professionals for this evening. I want to just make sure that I reassure everyone who's watching out there that Rocky Hill is going to be working very closely with the Department of Public Health, that we will be working hard on contact tracing, as well as the isolation process if and when that becomes necessary. We are working very closely with our Central Connecticut Health District. We have been preparing for this for quite some time. We have an active mitigation strategy plan in place presently, and we will continue to do all that we can do. Our hearts go out to the family of this patient here this evening. But as Mayor Bronin indicated, this was anticipated. This is part of the process, and this is what we were expecting. And so I just want to reassure everybody at home that we are doing what the CDC is asking of us, is recommending of us, and we just want to reassure you. Thank you.
Thank you. We will do everything possible to care for our patient, her family, as these days go forward. And our team is continuing to follow the process that we've been preparing for here within our system. We thank you for your attention this evening.
Can you tell us when she came to Hartford Hospital and how, like through the ER?
Sorry, could you repeat your
Can
question?
you say when she came to Hartford Hospital and exactly how, whether she came through the ER or she reached out to a medical professional on the phone?
You know, this is an individual in the 80s. She came from the ER, and we've been taking care of her for a few days now, and she's been well taken care of. Look, I think the important part is right now, it's in the community right now, and we're going to see some more cases, and I want all the members of the community to know that we will do all we can do to protect. A lot of things needs to happen in the community where social distancing and hygiene and other things needs to be really again and again talked about.
Can you say when she came to the ER?
You know, some of the information, I think at this time, a little too early to disclose. I think it's important for us to again remind the message rather than being specific about the individual who's being well cared by our team at this time.
Coming from the community, did she come from from her own home? Was she in a facility?
You know, I'm entirely sure this is appropriate to disclose in the public at this time.
Well, it could be very important to disclose if she was from her own home or in a facility,
Sure.
and how many other people might be concerned about that.
Sure, I think it's a great question. The process of investigating the detail requires contacting the family and working on this. Part of our team is right now working on making that happen. It's a little too early. We came in a few hours ago. We're still working.
All right, thank you so much. You
Do
can
we
get